CNA Test 2026 Wyoming Certified Nurse Aide CNA Exam 40 Real Questions Answers. Question 1. The normal adult pulse rate is 40 to 60 bpm, 60 to 100 bpm, 100 to 120 bpm, 50 to 90 bpm. 60 to 100 bpm is the normal range. Question 2. A resident is choking and cannot speak. What should you do? Wait for help. Perform abdominal thrusts. Offer water. Hit their back. Abdominal thrusts, Heimlich, for complete obstruction. Question 3. When a resident is on NPO status, they can have water only, ice chips only, nothing by mouth, clear liquids. NPO means nothing by mouth. Question 4. Which of these is a sign of skin breakdown? Redness that doesn't go away, tan skin, dry skin, freckles. Non-blanchable erythema is a stage 1 pressure injury sign. Question 5. A resident wants to complain about care. You should tell them to be quiet. Inform the nurse or ombudsman. Ignore them. Tell them they are wrong. Residents have a right to voice grievances. Question 6. What is the normal oral temperature? 96.6 F, 98.6 F, 100.2 F, 97.0 F. 98.6 F is average. Question 7. A resident is angry and shouting. You should shout back. Leave the room. Stay calm and listen. Call security immediately. Therapeutic communication involves staying calm. Question 8. Which of these is subjective data? Blood pressure, weight, resident's report of pain, pulse. Subjective is what the resident says. Question 9. A Foley catheter bag should be kept on the floor, above the bladder, below the bladder, on the lap. Below the bladder to prevent backflow/infection. Question 10. How should you identify a resident? Ask their roommate. Check their room number. Check their ID band. Call them by name. ID band is the standard identifier. Question 11. What is the golden rule of charting? Only chart at the end of shift. If it wasn't charted, it wasn't done. Use pencil. Include your opinions. Legal documentation standard. Question 12. What is the first step when discovering a fire? Rescue residents. Activate alarm. Contain fire. Extinguish. Race protocol starts with rescue. Question 13. How often should a resident be repositioned? Every 4 hours. Once a shift. Every 2 hours. Once a day. Standard is every 2 hours to prevent pressure sores. Question 14. When feeding a resident, you should rush them. Offer small bites and wait. Use a straw for everything. Talk to other staff. Prevents choking and promotes dignity. Question 15. A resident refuses a bath. You should force them. Respect their refusal and report it. Call their family. Tell them they smell. Residents have the right to refuse treatment. Question 16. A resident is in isolation. What is done with their linens? Double bag them. Wash in the sink. Throw them away. Shake them out. Double bagging or special handling per facility policy. Question 17. Which position is best for a resident having trouble breathing? Prone, supine, Fowler's, Sims. Fowler's, upright aids lung expansion. Question 18. A resident falls. What is your first action? Help them up. Call for a nurse. Move them to bed. Give them water. The nurse must assess for injury before moving the resident. Question 19. When dressing a resident with weakness on one side, dress weak side first. Dress strong side first. Dress both at once. It doesn't matter. Dress weak, dull, undress strong. Question 20. Standard precautions should be used for only HIV patients, all patients, only MRSA patients, patients with coughs. Standard precautions apply to all patients regardless of diagnosis.